Take Back Your Health Now, Episode 60.
You're listening to the Take Back Your Health Now podcast, the show that interviews the top doctors, athletes, trainers, and entrepreneurs to help you find the holy grail of health. Now here's your host, Dr. Dan Margolin.
This is Dr. Dan Margolin with another segment of Take Back Your Health Now, where we pull out all the stops in search of health's holy grail. I'm very excited to have Dr. Phil Carson with us. After 2 decades of running a successful pharmacy practice and then losing it all, Dr. Phil Carson entered a period of deep personal struggle. Each night he would walk along Country Road, hoping to find a few minutes of peace, but he ultimately discovered something far more valuable. What could you do if you had a simple plan to increase energy, get in better shape, and improve your mental and emotional health? You have more pressure on you than ever. Dr. Phil Carson felt the pressure too. He sacrificed his mental, physical, and emotional health to the demand of his pharmacy practice until he discovered the medications he was paid to dispense often offered only temporary symptom relief and left people still suffering. Dr. Phil discovered that true health and happiness comes from finding balance in 7 key areas. So he developed a simple plan anyone can use. In his new book, How to Live Until You Die, I love that title, he makes it simpler than ever to unlock a healthier, happier, and more whole you. So today can mark a new beginning for your total health. Dr. Phil Carson, welcome to the show, sir.
Oh, thank you, Dr. Dan. I really appreciate it. It's an honor to be on the show with you today.
Well, thank you. What a great title for a book. Well, before we jump into about you, how did you come up with that title?
It was a lot of going back and forth with my book coach, a guy that I hired me to help coach me through the book process. We went through a lot of titles. One day I threw that one out at him, and he loved it. He said, "That's it. That's the one. That's it." You
just know. Sometimes you know, right?
Yeah,
like
that's
when
right.
you meet the woman you're going to marry, and when you get the title of your book the right way, you're in.
Yep.
So Dr. Phil, so you're a pharmacist, right? What as a pharmacist, you wouldn't typically expect that you would be looking at natural alternatives. What made you as a pharmacist begin this journey of looking for natural alternatives?
Dan, it was my own health problems, my own health issues that I was dealing with. Right out of pharmacy school, I went to work for a big chain operation. And 1 year into that job, I was made the manager of this big store. The manager left, went to another company, and so they made me manager. Now here I am, a green pharmacist kid right out of pharmacy school with no managerial experience really whatsoever, and I became the manager, and it was major stress in my life, and that stress was actually literally killing me. The hours I was working on top of the stress of the job began to be more than I can handle. And I was suffering from severe digestive issues, severe gastritis. Some days I would end up laying on the floor just curled up in severe pain.
Oh, my God.
I slept in a recliner most nights because the reflux was so severe. And it was.
And now you're working in a pharmacy. You would think that there would be, take Imodium or something, or take whatever it is. And
I took everything.
You did? Okay.
Yeah, I took everything there was to take then, back in the mid '80s when this was taking place. As far as medications, I was taking several. I was drinking most days about 2 bottles of liquid antacid a day.
Oh my goodness!
Just to try to relieve the discomfort. And
did that work at all?
It gave me a little relief, what I call temporary relief, and it wasn't getting any better. And fortunately, a couple things happened. I was offered another job, working in a very small local independent store. So I jumped on that opportunity, took that job, left the big chain operation. And not long after that, as I was still dealing with these severe gastritis problems, I started doing some research. Started trying to find some answers because in this little small store, I had people coming in asking me questions about natural products and natural medicine, old herbal remedies, and those kind of things, and I had no idea what they were talking about. In pharmacy school, I was taught the history of natural medicine, not the application of it. So I set out on a course to start learning because I didn't like not being able to answer people's questions, not being able to help people that were looking for help.
So you started just trying to be helpful, just to entertain their questions. Got it.
Exactly. And in the course of doing that, I was in my research and in my study. I picked up a book one day and started going through it and found some answers to my problem. Found some of the underlying, one of the major underlying root causes of my digestive issues was. Of course, the stress was making it worse, but I discovered I had a problem called hypochlorhydria, which is low stomach acid.
Okay.
Plus, from all the medication use for years, all the stress, I had basically wiped out my normal gut flora and destroyed all my gut flora. I didn't even know what probiotics were. Wasn't taught that in pharmacy school, as most doctors are not taught anything about them in med school. So didn't know how important it was. So I started taking probiotics, started supplementing with hydrochloric acid supplement. Started taking digestive enzymes, which I learned was very beneficial as well, and it changed my life, changed my world. I'm forever grateful for learning that, and what I learned, I've shared many times over the years with other people suffering from those same types of problems.
Well, just to go back for 1 second, so you had acid reflux, which my concept would be that you had too much acid and you're taking these antacids basically to reduce that. Is that the basic theory that you had? And then you found out exactly the opposite. Is that true? I mean, is what I'm saying the right thing?
Absolutely true.
How shocking is that? How shocking is that to find out?
Yeah.
It's amazing.
Yeah, and it's very shocking to most of the people when I tell them that as well, that they're probably doing the opposite of what they need to be doing, like I was, and they should be supplementing with acid instead of blocking the acid or taking an antacid. And that was my case. And actually, since I learned that years ago, there's been books written on that subject. And the problem of people taking these antacids when they should be supplementing with some kind of acid supplement. And it makes a world of difference for a person who actually has this condition of hypochlorhydria that I'm talking about.
How would you diagnose, or how would you be diagnosed with this? How would you find out that you had this?
Well, there's different ways to diagnose it. Person can go through different medical procedures to have it done. There's actual tests that can be done to determine the basic acidity levels in the stomach. But the way I discovered it was a little home test that this doctor recommended in his book. And it was simple as drinking apple cider vinegar or pure fresh squeezed lemon juice when I was having an attack. And basically what the test says, if you drink one of those and you get relief, then your stomach acid is most likely low. If you drink it and your symptoms get worse, your stomach acid is probably too high. That's not 100%. It's a screening tool more so than a diagnostic tool, but it worked for me, and it's worked for many other people.
It gives people an ability to at least know what direction to go in. I think it's great. I've never heard this. I'm telling you, I love doing this show because I get to speak with people like yourself that are so interesting and that so change my viewpoint on things. So I appreciate it. I mean, at what point did you recognize that some of the things you'd found out that you really needed to get serious about getting this information out there? And then how difficult was it for you to veer away from the pharmaceutical fields that you were already in?
Well, it was a progress, and over the years of me learning, and me learning about this for my own health problem inspired me to keep learning and to learn more. So I started taking courses. I found people or companies that were offering courses in natural medicine and natural therapies. Then I started taking these courses. Sometimes I would travel, go for 3 or 4 days of just intense classwork courses over 3 or 4 day period, usually on the weekends. And I would get these certifications. They would be offering certification courses in various natural therapies, and I still take those courses today. Every year or two, I find a course somewhere and I take it, or I go attend a conference or seminar where they're offering these educational classes or certification programs.
Dr. Carson, are these courses, are they specific to a certain type of disease or ailment, or
Yes.
are they more generalized?
Yeah, they're usually specific. There are some generalized things out there, but usually I'm taking something to a specific problem or ailment or disease, condition, whatever.
And what interested you the most? Like, what are the diseases, I guess, that you've taken the greatest interest in, and what are some of the more common treatments for them?
Well, of course, the digestive issues was a big thing because that was, what I was suffering with. Diabetes is another. My dad was diagnosed with diabetes several years ago. Another thing of great interest to me has been fibromyalgia. I've had numerous patients, clients over the years through the pharmacy, through the health coaching that I do, that have suffered with fibromyalgia and chronic fatigue syndrome. Another is ADD, ADHD. Had a lot of kids, a lot of parents coming to me for help for some kind of natural solution for ADD and ADHD. And it's a big problem out there. And most of the kids that are diagnosed with ADD or ADHD, in my opinion, don't have it. And it's not a real medical condition. It's a set of symptoms.
Right.
And what I often say is these kids have been labeled ADD or ADHD.
Right. It's really is a labeling. It's really a stigmatism that's attached to these children as well.
Yeah.
Matter of fact, and then the solution to it is basically, here's my cynicism, but crystal meth. It's essentially, that's what Adderall is, right? It's crystal meth.
Yeah.
If it was labeled something, if you labeled it as crystal meth, you wouldn't give it to your kids, but you put a different label on it, and all of a sudden we're off to the races.
Yeah.
Is that pretty much what you found?
Exactly right. And back years ago, when I had a couple of pharmacies that I owned, I had opened up one, and then a few years later opened up another one. And both of these pharmacies were what I called integrated pharmacies. The second one I opened up was originally designed to be just a natural pharmacy, but we ended up doing some prescription stuff in it as well. But in these pharmacies, I made a decision one year after reading an article that came out in Time Magazine or Newsweek about these medications and likening them to cocaine. The article called it kitty cocaine. And so after reading that and reading that, the article was written based upon some studies that had been done. And so I said, this is not right. I can't continue to dispense these medications to kids when it's doing this. When I see what this studies and what this article is saying that it does to these kids, and so I made the decision right then. No more. I'm not dispensing them anymore. So parents would come into the store with a prescription for one of these amphetamines, and I just politely told them, I'm sorry, but I've made the decision not to dispense these medications anymore. But I'll be happy to talk with you about some natural alternatives, because I had also around that time learned that there were some courses available for natural alternatives for ADD and ADHD, and I took those courses and learned what I could to help people. So I would share that with them, and 9 times out of 10, they would say, yes, I had rather not give my child this medication anyway. I don't really want to do it. I want to know about the natural stuff that you're talking about.
Well, that's what you're saying is so powerful. So a lot of these parents actually were not completely informed as to possibly what their child was going through and what was actually in the medicines. Is that a pretty accurate statement?
Absolutely. All they were doing, they were just following directions about, the school would say, we think your child has ADD or ADHD, they need to get tested, or they need to go to a doctor. Most of the time they weren't even tested. The school would make the diagnosis. They would go to the doctor. Doctor would prescribe them a medication, and they didn't know what they were getting. All they knew was they wanted something that was going to calm their child down, something that was going to help their kid make better grades.
And meanwhile, a lot of these children are malnourished, right? They're being given sodas and things that'll actually increase their hyperactivity. That I have to assume is what the school many times would be picking up as ADD, ADHD.
Yeah.
Yeah. Well, first of all, my hat's off to you to actually have sort of the ethics presence to, I'm sure you lost some money too on doing that, because I'm sure that with the pharmaceutical companies and stuff like that, it's probably more lucrative to put children on those medicines than it is to say, hey, let's step back and really evaluate that. So my hat is off to you, sir. The first time I've heard about this years ago was I saw a study about the increase in suicide rates among children that were on these medications. And It was so astonishing to me. I mean, it was not a small percentage. It was a relatively dramatic increase. It was known by many of these companies. And is that also what you saw?
Oh, yeah. Yeah, absolutely. What was really saddening and sickening to me was to see some of these kids, before I made this decision, end up, they would start out on one of these amphetamines, and it would be, a matter of months later, they would end up being on 2 additional drugs, often an anti-anxiety drug and an antidepressant drug. And they would end up on a cocktail of drugs.
What you're talking about, I interviewed Dr. Linda Lagaman many, many episodes ago, but she talked about exactly what you're talking about and the mechanism behind it. Yeah. And it also, that interview really changed my viewpoint so dramatically, because I had an understanding of really how actually detrimental many of these medications are not. Do you think that doctors actually understand that, or do you think they're just having a rep come out to them? What's your viewpoint on that?
Well, I think some of them probably do, but many of them don't. And a lot of times, the doctors are trying to help somebody. They're thinking, well, the parent is sitting there and the parent is, distressed, probably crying, saying, my child's got to have help. I've got to have help, because it's tough on the parent as well when you got a kid that's bouncing off the wall and
Sure.
getting in trouble in school every day. And, they're looking for some kind of solution. And, a lot of times, the doc is saying, well, hey, I don't know anything else. This is what the protocols are. This is what's recommended. So I'm going to write you a prescription for this, and
right.
Try to help get you some help. And so a lot of times I think it's more to appease that parent, give that parent some kind of relief, because the parent's sitting there begging for help, begging for something to, and most of the time the parents don't know. They don't have a clue what the dangers are of that medication and what can happen down the road with continued use of it.
Well, the reason I found out about this is just because people like yourself were kind enough to actually take the time and explain these things to me. And again, I think a lot of doctors are not privileged to that information, so they're trying their best. And like you said, there's a protocol that's given to them, and they're following the program, and they're not really questioning it. And I think things, you coming out and going over this stuff is really helpful also for the doctors, because like I said, most of them really just genuinely want to help people. They just don't have the tools or haven't been given those tools. So Dr. Carson, what would be, I cut you off a little bit early, but what would be some natural remedies for ADD, ADHD?
Well, the number one is diet. Changing the diet in most cases will do wonders. What I learned in my studies is that a lot of the ADD, ADHD issues, especially ADHD, where there's the hyperactivity component of it, is diet related. The diet makes it worse because they're eating sugary foods, eating high carb foods that convert to sugar. Their blood sugar levels are bouncing all over the place. And most of these kids are actually craving these kinds of foods because they have an overgrowth of yeast in their gut. They have leaky gut syndrome, or they have some type of gut issues where they're craving these kinds of foods. And
how do you correct that?
How do we correct it? Is that what you said? I'm sorry.
Yes, sir. How would you correct that? Yes, sir.
Yeah. That's well. First, we make changes in their dietary recommendations. Try to work toward getting them off of these sugary foods, these high carb foods, getting them eating more protein, more natural foods, more fresh foods. At the same time, if there is an overgrowth of yeast in the gut, you take either prescription or natural antifungals to help get that yeast under control, and it makes a world of difference. You also give natural anti-inflammatories like fish oil to help reduce inflammation in the gut. You give the probiotics to restore the good bacteria that's been wiped out. And usually, not what I discovered, but what I learned in my studies, who really, I think, one of the pioneers in the area of this was a doctor named Dr. William Crook. He was a pediatrician from Jackson, Tennessee, that was more of I think, one of the pioneer doctors in discovering this problem and this issue with hyperactive kids, is that there is most likely an overgrowth of yeast. And it's what I learned, there was a common thread, as he talked about, he learned in his practice, was that most of these kids who are suffering from these problems had chronic ear infections or chronic respiratory infections as an infant or in their toddler years, and they were on multiple antibiotics.
Wow.
As well as steroids, and their gut flora was pretty much wiped out. And when you cleaned up the gut, you restored the gut flora, you got rid of the yeast or got it under control, you would see dramatic changes in these kids. And they didn't need drugs. They just needed a healthier digestive system. They needed to be eating healthier. And it was amazing to see the difference.
It's amazing. I've spoken to many guests now who concur exactly with what you're saying. I wonder, when you do have children, as a doctor, again, we're not taught this. So when we do put children on antibiotics, because there are times when you don't have a choice, but should they then be followed up with these kind of probiotics immediately, or how should that, what would be an ideal scene for a doctor that is put in a position where they do have to put a child on an antibiotic?
Yeah, absolutely. Well, what I recommend is when a child or anybody goes on an antibiotic, that they immediately start taking the probiotics, start replenishing what's being wiped out. And of course, you want to take them several hours apart from each other. But I usually will recommend they take a double dose of the probiotics, and as well as try to eat probiotic-rich foods while they're taking the antibiotics. And once the antibiotic therapy is complete, continue on a course of probiotics for at least 2 or 3 more weeks, taking them once a day. And then after that, they can cut them down to every few days and continue to take the probiotics on a regular basis, or either eat probiotic-rich foods on a
What are
regular basis.
what are some probiotic rich foods?
Well, the most common one that people eat is a dairy product called yogurt. A lot of people
Okay.
love yogurt, eat yogurt on a regular basis. Buttermilk is another one as far as dairy goes. I'm not a big proponent of those because of the dairy allergies that a lot of people have, including myself. But there are a lot of other good probiotic-rich foods out there, and there are some non-dairy yogurts now that are available. Also, you've got the soy-based ones like tofu. You also have a vegetable sauerkraut made with fermented cabbage. And one of my favorites is kombucha tea. Kombucha tea is very rich in probiotics. So, some of it is pretty tasty. Some of it.
Where would you get that? Where would you get that at?
Well, most grocery stores have it now. Kombucha tea over the past 3 or 4 years has become extremely popular, and most all of your grocery stores stock it now because people are asking for it. People are drinking it, and there's a variety of companies that are producing some really good kombucha teas. Of course, you can make it yourself, just like you can make your own yogurt. You can make your own tofu or kefir, those kind of things. You can make your own kombucha tea at home, and I've got several friends to do that. I would actually do it myself if I was home enough to do it. I travel a lot, and I'm extremely busy. I'm afraid it wouldn't work very well with me being gone a lot.
No, I understand. Well, let's go back. I just want to go back to another thing you spoke about, which was fibromyalgia. I just had 2 patients and young people with fibromyalgia, and trying to determine why they have it and everything. One of the reasons I started this show, quite frankly, is because I was really searching for answers to some of these situations that I just didn't have the good answers for. And one of them was fibromyalgia. So maybe you could actually help me personally in this journey and tell me, what is fibromyalgia? What have you found, and what treatments have you found to be effective?
Well, fibromyalgia is like ADD, ADHD. It's pretty much a label, and it's a set of symptoms that people have, and sometimes those symptoms vary. And for years, especially, I don't know, back in the 80s, late 80s, early 90s, I would have women primarily. Every once in a while it'd be a man. But it's primarily women coming to the pharmacy saying, I've been diagnosed with fibromyalgia. And they would say that's what they think it is. But for years I've been told that it was all in my head. And somebody finally came up with a name for all these symptoms, and they called it fibromyalgia because it affects the fibrous tissue of the body and causes tenderness and pain in certain areas of the body. So somebody came up with this name for it, but for many, many years women suffered and they didn't know what they had, and they were being given antidepressants, anti-anxiety drugs, all these kind of things. But Dr. William Crook, that I mentioned, the pediatrician that worked with ADD and ADHD kids primarily, he wrote about this and talked about this as well because he recognized it as being the same underlying cause that a lot of these kids with ADHD were suffering from, and it was the gut issues.
Wow. Okay.
And these women most of the time would have an overgrowth of yeast in the body, and of course they were dealing with all kinds of emotional issues because they weren't sleeping, the pain, constant pain, discomfort, fatigue, just tired all the time, wiped out, and it just the problems just kept piling up. The symptoms kept piling up, but it all goes back to the gut for most of these people. And of course, hormone imbalances have a lot to do with it. And also stress in people's lives have a lot to do with it as well. So it's not just one, you can't just pinpoint it and say, put your finger on one thing and say, okay, this is it, this is the underlying cause of fibromyalgia. You have to look at the whole picture. And
but it definitely some portion of it is coming from the gut in many cases.
Exactly. Absolutely.
Yeah.
it's when you clean up the gut, like I was talking about a moment ago, restore things there, restore balance to the gut, a lot of the symptoms go away. And I've seen that happen several times over the years in working with these patients, making natural recommendations to them for the natural products that are available to help in relieving some of the discomfort and helping restore balance to the digestive system.
Well, thank you for that, Dr. Carson. Dr. Carson, our show, we're in search of health's holy grail. If I were to pose that question to you, what do you think the holy grail of health is?
Well, one of the things that I talk about a lot, Dr. Dan, with people is that so many people today, especially today, are suffering from health issues, physical health issues, because they're soul sick. It's not a physical problem that's the underlying cause. It's an emotional problem often that's the underlying cause. They're emotionally unhealthy. They're emotionally sick. And a lot of times it's because of something that's happened in their life, some type of tragedy, some type of traumatic event, some type of emotional hurt, emotional pain that they haven't let go of. That's not the case for everybody, but it is for a lot of people that I see, a lot of people that I work with, that they need to be addressing those emotional issues. So I feel like in a large number of people's case, that holy grail is to address the emotional things in your life, address what that stress has done to you, address what the emotional hurt and emotional pain or the traumatic event that happened in your life has done to you, how it's affected you. And sometimes for people, it needs to be just, recognizing that's the source, or recognizing that, hey, I need to forgive this person that's hurt me. Or in a lot of cases, like my own case several years ago, I need to forgive myself for a failure in my life. And when I've learned, or when I've realized, hey, I've forgiven everybody else that's hurt me, but I haven't forgiven myself.
Wow.
And
powerful.
It changed my life when I did that. And
so the real stress is not only the stress that you live through, but it's your reaction and your viewpoint towards that stress.
Exactly right. Right. And it's your viewpoint toward it, your attitude towards stress in your life, and and how you handle it, how you manage it. But there's been some recent studies done that show that people's attitude towards stress can actually be more detrimental to their health than the stress itself.
Yeah, understood. Dr. Carson, I want to thank you, sir, for being on the show. How would people that want to learn more about you, learn more about your book, how would they do so?
Well, they can go to my website, carsonnatural.com. They can also go to the book website, howtoliveuntiliyoudie.com. We've got a big book promotion going on all throughout the summer on that site. So be happy to have people go there, check it out. Check out carsonnatural.com. I've got free resources on my website of carsonnatural.com. One free resource I'd love people to go check out would be a resource I have on stress. It's a stress assessment and a stress guide, 7 keys to stress relief guide I have on there. So those are some things that are available, and quite a few other free resources there as well.
Dr. Phil Carson, thank you, sir. Have a wonderful day. Greatly appreciate it.
No, thank you, Dr. Dan. I really appreciate it.
This episode is sponsored by New Jersey Foot and Ankle Center in Oradell, New Jersey. Remember, when you have a foot problem, you've got a foot doctor in the family. Weekend and evening appointments are available. Call us at 201-261-9445. Once again, that's 201-261-9445. Thanks for listening. Check out the show notes over at drdanspeaks.com. If you're loving the show, head over to iTunes and leave us a review, and we'll catch you next time.